Good morning. For this video, we're going to be talking about test taking strategy, specifically the ABC. So in the board exam, there's questions needing critical thinking, and sometimes you really need to have this test taking strategy, especially the ABC, because this is one of the most common type of questions in the board exam. So let's get on with this. So first is the ABC system is means airway, breathing, and circulation. So airway is always the first priority in caring for the client. So when you talk about the client's priority, if the scenario chooses includes airway, then most probably that will be the best answer. So airway, it is the prioritized assessment or intervention related to airway or to patency. Then we have breathing, meaning you have to assess for the status of the breathing pattern. So assess for dyspnea, tachypnea, and gasping. And then third is your circulation. Circulations consist of the assessment in the cardiac or circulation problems, such as bleedings, pulse rate, and blood pressure. So make sure that if these choices comes out, airway is always your first answer, is your priority. For example, a client with a diagnosis of cancer is receiving morphine sulfate 10 milligrams subcutaneously every 3 to 4 hours for pain. When preparing the plan of the client, the nurse should include which priority action. So when you're talking about priority, so first things first, your STEM question is when preparing a plan of care for the client, the nurse should include which priority action. So this is your STEM question, correct? Now, in your STEM question, you have your clue. Your clue is trying to identify your priority action. So priority meaning first action. So in talking about the ABC, you always remember that airway is your priority. Aside from that, when you're talking about morphine, if you will integrate your knowledge in morphine, you know that morphine, the drug morphine is considered a muscle relaxant and can depress your respiratory function. So it is a respiratory depressant. So with that knowledge, so you will now take a look at the choices. You have monitored the stool, urine output, encourage fluid intake, encourage client to cough and deep breathe. So with these choices, so which of the following choices relates to your airway? It is your client to cough and breathe. So most probably your best answer would be letter D. All right. So the correct answer is letter D because you are taking priority action. So this is pertaining to your ABC or your airway. All right. Next. So note that the rationale for this is again what I've said, priority and the focus of the subject which is morphine sulfate, which is considered a respiratory depressant. Now, in using your ABC technique, airway, breathing, and circulation, you will point to the answer that A is letter D is your answer because it addresses the airway. All right. Next, let's try another question. So you're a newly registered nurse and are assigned in the emergency room. You are assessing the client's condition after cardioversion. Which of the following would be your highest priority? Again, so this is assessing. So in assessment, which of the following is a priority? Again, you follow your ABC. So let's see the choices. We have blood pressure, status of airway, oxygen flow rate, level of consciousness. So considering ABC, status of airway is your best answer. So let's take a look. All right. So letter B is your highest priority as per your airway, breathing, and circulation. Airway is always your priority. Now let's take a look at the rationale. Here, note the strategy word or the clue is the highest priority and the focus is your cardioversion. So if you have integrated knowledge regarding cardioversion, you know that maintenance of a patent airway or airway is always the #1 priority. Second is your oxygen administration. Next is the assessment of vital signs. Number 4 is your level of consciousness. And then number 5 is dysrhythmia detection. So these are your steps or nursing intervention when taking care of a patient who underwent cardioversion. Again, airway is always your priority, right? Now, another question would be, you are a newly hired preoperative nurse in the hospital. You are providing preoperative teaching to a client scheduled for a cholecystectomy. Which intervention would be the highest priority in your preoperative teaching plan? Again, talking about preoperative teaching plan. So this is your subject. And then highest priority. In the preoperating health teaching, airway is still your priority, your highest priority. So again, ABC. So which of the following here relates to airway? Teaching leg exercises, instructions regarding fluid intake, coughing, deep breathing exercise, assisting client understanding in surgical procedure. So you have here teaching, coughing, and breathing exercises because this relates to your airway. So letter C is your answer. So letter C is the correct answer because it is your airway, pertaining to airway. Now, again, the rationale for this, highest priority and preoperative care. Now, using your ABC, airway, breathing, circulation, so airway is your priority. Letter C relates to airway, which is the best answer. Now, after colostomy, breathing tends to be shallow because deep breathing is painful and as a result of the location of the surgical procedure. Now, so although all options are a component of preoperative teaching plan, teaching the importance of performing coughing and deep breathing exercise is the priority in preoperative plan of care. So again, remember, airway is always your first priority. It is always your best answer when talking about priorities. Okay, so especially in the board exam, guys, remember your ABC. Airway, breathing, and circulation. Airway is always your priority. So if you find this video helpful, please like, share, and subscribe. And thank you. God bless.